is Mental Health Awareness Month, and one county is expanding its services to a population they say is struggling right now. Hancock Health's mobile response team sends trained clinicians to meet Hoosiers in crisis wherever they are. I looked at how they'll now be serving those as young as 5 years old.
Thanks for calling the mobile response team. This is Nate.
A critical phone call Hancock Health's mobile response team can take dozens of times a day.
What's the situation looking like?
And each time, the goal is the same.
Our hope is that we can decrease those calls for mental health or substance misuse to law enforcement.
The unit launched in 2023. Since then, Christina DeWitt says they've worked with local law enforcement to connect thousands of adult Hoosiers to mental health resources.
We now have the opportunity to meet individuals where they're at. So before that, individuals did not know where to go, who to call, or they were actually calling 911 or law enforcement.
Now the team is expanding their services to a population they say has been struggling.
We have noted a significant concern and a gap for serving youth.
According to a youth risk behavior survey from the CDC, in 2023, nearly 1 in 4 Indiana high school students reported having made a plan to die by suicide. More than 1 in 6 reported having attempted it. That's an increase from 2022.
They are struggling with the impact of social media. They're struggling with bullying. They're struggling with peer relationships.
I mean, I could look at my computer screen this morning and see juvenile complaint calls that are all about basically mental health or some type of relational issue that they want cops to go to. And frankly, those aren't typically law enforcement matters.
Fortville police officer Philip Allen says cops bring something to the conversation that the mobile response team doesn't.
We bring a gun to every conversation, and oftentimes those conversations don't need to have that weaponry with us.
These individuals are coming out trained in mental health and substance misuse in order to have the availability to support them and care for them without the stigma or concern of repercussions from law enforcement.
The hope is to save a life by connecting Hoosiers to help.
And help bridge a gap for mental health for kids. More importantly, I would argue the community as a whole is much better off.
We want to reduce the risk of suicide. We want to reduce the risk of incarceration, and we want individuals to feel safe.
The team tells me clinicians will not respond to a scene if it's unsafe. Instead, they will work with law enforcement to connect with them after. They say with the recent expansion, they'll now also be able to connect with kids in school, too.